Today we have updates on testing plans and on health data. First, let's talk about testing. The ability to run large numbers of tests is key to any plan to ease restrictions on businesses and gatherings. At the beginning of this pandemic, you'll remember testing capabilities were extremely limited around the nation. We had to use CDC tests and ship every one of them to Atlanta and wait for results. We also didn't have nearly enough of those tests. This has been a problem across the country as well as here in Virginia. Then we began to be able to do testing in-house at our state lab. And in the weeks since, our testing ability has steadily increased. A number of private labs, hospital systems, and universities have created their own tests in addition to the state lab tests. Now, our hospital systems that have in-house testing capabilities are scaling up their capacity. We had experienced a backlog in private labs testing patients from hospitals. Those backlogs are being reduced, partly because the private labs have made hospital samples a priority. It's important to quickly identify positive cases in hospitals because our doctors and nurses have to use PPE with possible COVID patients. If someone tests negative, some of that PPE can be reduced. And the Division of Consolidated Laboratory Services, the state lab, has increased its testing capabilities. Right now, they can run more than 300 tests per day. DCLS has also just received equipment from Altria that will allow them to run more than 400 tests per day by next week. So between our state lab, the private labs, and the universities and healthcare systems, we are steadily increasing our testing capacity in Virginia. Throughout this process, governors, labs, and healthcare systems have literally been competing for the same supply of reagents and swabs, just as we have done with PPE because of limited national guidance. To make sure all of Virginia's public and private testing efforts are coordinated and pulling in the same direction, we have created a testing work group. I have appointed Dr. Karen Remley and Dr. Lillian Peek to head up this work group. Many of you know Dr. Remley from her former role as Virginia's Commissioner of Health, and Dr. Peek is our state epidemiologist. The work group will include representatives from the Hospital Association, long-term care facilities, emergency room physicians, free clinics, private labs, and the state departments of health and emergency management. This group will make sure that we have the testing capabilities and supplies we need as we move forward into the summer and fall. The work group will focus on three things. It will make sure that we can expand our test sites and our testing criteria. Right now, our criteria focuses tests on people who are hospitalized, people who have been exposed to known positive cases, emergency responders, and now people who are residents or about to enter long-term care facilities. It will work to increase testing volume and timeliness, to decrease backlogs and keep up with demand. As you maybe remember, when we started this process a few weeks ago, results were not coming back for sometimes 7 to 9 days. And it will address the factors that limit our testing, such as getting testing supplies like swabs, specimen collection supplies, and containers to safely transport viral specimens. These are all critical components because testing isn't just about the test itself. Labs might be able to run tests, but until doctors have enough swabs to do the test and we have enough supplies to safely transport the test, we cannot meet the need for testing. We're also encouraging clinicians to get their symptomatic patients tested as supplies allow. Early on, the lack of testing meant that doctors relied on what we call a clinical diagnosis, a diagnosis without a test for patients who didn't need to be hospitalized. Today, Dr. Oliver will send a clinician's letter encouraging doctors to test those patients, so we have a more accurate picture of positive tests. Earlier today, I was on a call with the White House and other governors to hear about the Centers for Disease Control's plans to assist states with testing. The CDC will be sending teams to each state to focus on vulnerable populations. They're also allowing state labs to act as the FDA to approve tests and are working to help get more swabs while also allowing states more flexibility in the testing components we use. This additional support will be very helpful. The big question on people's minds these days is, when can we ease restrictions and allow businesses to operate as they used to? The White House guidance, the CDC guidance, is that to consider a phase 1 of easing restrictions, states must have 14 days in which case numbers decline. I want our businesses to be able to be opened again and people to get back to work. But we have to do it in a safe manner, and testing is the key to those next steps. I'll ask Dr. Remley to say a few words about the testing work group. Dr. Remley, thank you and welcome.
Thank you, Governor and Secretary, and everybody from the Department of Health leadership. It's such an honor to be able to be working with them again. As someone who's worked as a doctor, a public health official, and the chief medical director of our health plan here, I have seen public health from a lot of different angles. I fully understand the importance of everyone working together and the challenges of keeping all of our public and private health agencies working in concert. I also know that everybody is very eager to reopen the country, as the governor said, and particularly here in Virginia. As a physician, I know that depends upon our testing and coordination. That's true around the country, that's true here, across the state. We're moving into a new phase, as the governor said. Our job with this working group will be to help ensure that everyone knows how they fit into a coordinated statewide testing plan and what the other groups are doing. And by everyone, I mean the universities, the private labs, the state lab, the public health system, the health systems, and equally as important, the doctors and nurses and healthcare providers who care for everyone at their bedside, in their offices, what their roles are. We'll also work with the CDC, which is promising additional staffing to the states, along with additional flexibility in obtaining supplies and tests. We think by really, now that we have an opportunity to take a breath and coordinate these efforts, we will be able to ensure that people who need to get tested because of their health conditions, as the governor stated, and the priorities, get tested first, but that we can also open up to more communities, more people to get the testing going so we can move our country and our state forward. We'll be able to better manage supplies of critical test components like swabs, reagents, and secure containers. We have a lot of work to do. I'm excited about taking on this opportunity to help the people in the Commonwealth of Virginia, and I'm honored to be working with the leadership.
Thank you so much, Dr. Remley. But thank you, Dr. Remley. We have based all of our decisions thus far on science and data. I understand the need for the public to see more of the data that we're using. That's why, starting today, the Department of Health will expand the data it shares with you, the public. On a daily basis, the Virginia Department of Health will share numbers of cases, hospitalizations, and fatalities by locality. It will also share the number of cases, hospitalizations, and fatalities at the health district level with demographic information such as age and/or race. Ensuring that the public gets this type of information is a critical part of VDH's job as the Public Health Department. I'll now ask Virginia Health Commissioner Dr. Norm Oliver to provide a health data update and explain the data reporting, and then we'll hear from Dr. Lori Forlano to provide an update on long-term care facilities. Before I ask Dr. Oliver to come forward, we put out an executive order last week regarding clinicians from other states, regarding nurse practitioners, et cetera. One of the things that we failed to put in that executive order was to allow PAs, physician assistants, to be part of that medical team, and I've had a lot of questions about that. Nurse practitioners and PAs play a very important role in Virginia, and we want both of those to be included as we move forward. So that was an oversight on our part, but we want to make sure that our PAs and our nurse practitioners feel that they're valued and we appreciate all their work. Dr. Oliver.
Thank you, Governor. Good afternoon. This morning, our VDH website was updated with the numbers of cases and deaths. The total number of cases now stands at 8,990 cases, and that's 453 more cases than in the last 24-hour period. And obviously, since Friday represents a significant increase with a couple of other days of new cases. Total number of deaths now stand at 300, and new deaths in the last 24-hour period is at 23. As the governor mentioned, Dr. Furlano will talk some more about the long-term care facilities, which still represent the majority of the outbreaks across the Commonwealth. We have 139 outbreaks, and 77 of those are in long-term care facilities for about 55% of the outbreaks, and they represent among the cases about 10% of the cases across the Commonwealth, but about 26% of the deaths. We have been tracking as best we can the race and ethnic breakdown on both cases and deaths. African American cases number about 28% of the cases for those cases for which we have race and ethnicity data. And for those deaths for which we have race and ethnicity data, they number 34%. I mentioned previously that we have been improving the race and ethnicity data that we receive on both cases and deaths. We're missing only about a third of that data in terms of cases, and we're now down to only about 3% missing in our death data because as death certificates come in, we get more defined data there. And I just want to underscore what the governor said about our decision to release more granular data. We understand the fear and anxiety that many people have around this pandemic, and giving high quality, accurate data in a timely fashion will help address this additional public health need that we have in facing this pandemic. Thank you.
Hi, good afternoon. I'll have a brief update about our long-term care facility task force. As Dr. Oliver, I believe he already spoke to the outbreak numbers. 139 outbreaks in total across all settings have been reported as of today, and 77 of those, or about 55% of them, are in the long-term care setting. There's been a lot of activity over the weekend in working to shore up our processes and procedures for supporting expanded testing in these facilities, and I'm happy to report that we've already received requests, and we're working through deploying those resources and support to these facilities. We're also working to think through how we can best support these facilities, particularly the ones who haven't experienced an outbreak yet, in assessing their infection control practices. It's always good to refresh your practices around infection control and how to control disease transmission. We'll be working with CDC to hopefully offer some virtual assessments or tele-assessments on infection control to some facilities. And those facilities that are in the early days of experiencing an outbreak, we hope to deploy staff from the health department to those facilities as resources allow to do on-site infection control assessments. It's a service we provide pretty routinely on a regular basis, so we hope to continue that. That's all I have today. Thanks.